Good afternoon, ladies and gentlemen. My name is Ruben Ojo, a student under the NPH program, Fresno State. Um, Today, I will be sharing questions on the forthcoming CHES exam, either for those that are writing this spring, which comes up on different dates, or for those writing in fall, which I think is around November 20th, thereabout. I can't be so sure. So I'll be recording this session that will specifically talk about the area of responsibility number 8. And we're probably not going to be explaining the materials. I'll probably do a few explanations here and there, but it's basically about the questions from the CHES part of the book. Now, if you have the NCHEC book, you are going to see two sets of questions. One for CHES and one for MCHES. The MCHES is the master's you do after the CHES after a number of years, right? However, like I've told my friends and classmates that are writing the exam this spring semester, there is not so much difference between the MCHES and the CHES question. If you can look at the CHES question, I believe you're also in a good position to go ahead and try your luck on the MCHES, right? How bad can it be? So this afternoon, I'm going to probably look at a couple of questions on the area number 8. And as the week progresses, I'm probably going to release some other videos from areas 1 to 7. We'll just do it at random. Areas 3, probably 4, 5, and things like that, okay? So now I'm going to start sharing my screen so we can look at the questions together. I'll probably choose my answer, which I believe should be the right answer, and give an explanation why that is the answer and why some of the other ones are not the correct answers, even though they look like the right ones. So I'm going to share my screen in a minute. Let me see. There we go. All right. I believe everyone can see my screen from here on. So, like it's rightly tagged on the screen, CHES practice questions are area number 8. And of course, that area number 8 is termed ethics and professionalism. Now, I believe this was just added sometimes last year, if I'm not mistaken, for the new edition of the book, right? So area 8 was just added, I believe. So we're probably expecting a couple of 10 questions at best, not more than 15, because technically none of the areas really has more than 16 questions in the book. So we're expecting a total number of 165 questions in the exam. We're expecting 10 dummy questions, which means even though you answer them right, they're probably not going to count. They'll be focusing on 155 questions, and you'll be expected to have a good percentage to pass in those 155 questions. So let's begin. Question number 1. A health education specialist is working on a new community planning initiative. The specialist, excuse me, wants to address community support and social network factors. What determinants of health, therefore, will be addressed? Okay, so I think option A says economic stability, B says social and community context, C says education, D says health and healthcare. Now, if you look at the construct of the question, the second part from here says the specialist wants to address community support and social network factors. That is where the question is, all right? Now, as we all know, there are different kinds of social determinants of health: education, occupation, community context, and all of those things, right? Race is also a big social determinant of health. So, however, this particular question says it wants to address community support. What has to do with the community? What has to do with the general population, all right, and the social network? So, of course, economic stability could have made more sense if we are addressing something about income, something about job occupation, right? So that it's not going to fly. Social and community context, let's leave that for a while, for a minute. The next one says education. Now pay attention to what we are addressing, community support system, all right? So that means we're probably looking at a model. We're trying to look at a determinant that speaks to the society and the community. I think this is probably the easiest question you can have on the CHES exam. And of course, if the question says community support and social network, I also believe the answer should be social and community context, because that is what we're trying to look at, the community and the society. So we're going to go with B as the answer here. Of course, if you look at health and healthcare, that is really not a determinant of health. Health does not determine health, all right? So that is even a wrong answer on its own. So question number 2, a health education specialist is targeting different groups of young adults for a physical activity intervention. The specialist wants to work with those who are ready to take action, to get active within the next month. In what stage of change are these prospective participants? Now, when you look at the question like this and you look at the options, immediately, if you've studied the material, something should be coming to your mind. This is talking about a model of change, all right? If you look at the option, it looks like a model of change. Now, the first question you want to ask yourself, and for the course of the exam, you have 2 hours, 30 minutes. That's enough time to do some thinking. So, first of all, you want to identify what is this theory about? What is the name of this theory? So this would be the trans-theoretical model of change, all right? And you want to look for the keywords. You want to look for the keywords in the question. The second part says the specialist is looking for those who are ready to take action, all right? Now, think about the word ready to take action. Action has not been taken. They are just in the mood, or they are just getting into the process of doing something. Now, the first one says pre-contemplation. And from the CHES book, what does that mean? It means people who are undecided. They've not decided if they are doing it or not. The next one says contemplation, all right? The people in the stage of contemplation, they have decided they will probably do it, all right? So they have left the stage of either doing it or not doing it. These ones are in the stage of, am I doing it? And if yes, when am I doing it? All right? They are undecided about the time frame. Now, not the word time frame, all right? So that takes them from a stage of pre-contemplation to contemplation, all right? Now, the next one says preparation. Basic English word. What does that mean? It means you are getting ready to do something, all right? So as an health education specialist, if you are going to embark on a new program or evaluation or implementation, you plan to do it, right? You plan for the data collection instruments. You plan out, you try to know what your priority population is. That's preparation. And of course, the group of people who have taken action are those who have decided. They've done it already. And the only thing we are waiting for is the outcome. And please remember, this is just 4 stages, right? And we have 6 stages in this model, which I think the last 2 should be maintenance and one other one I really can't remember right now. Should be maintenance and If I think hard enough, I'll probably remember, okay? But for the sake of this question, look at the option preparation. The question says they are getting ready, all right? They are not there yet. They've made a decision, all right? They've made an attitudinal decision, all right? However, they are still going to do it in the next month. So there's a stage of preparation for them. So the right answer here, I believe, should be preparation. Let me see. Yeah, should be preparation. For question, let me try to put the answer right here. Answer B. Sorry, C, preparation. All right. Next question. The health education specialist is working with community groups to conduct legislative advocacy for change in the community. What theory will best assist with this strategy? Interesting question. Option A, theory of planned behavior. Option B, community organizing model. Option C, trans-theoretical model, right? And option D, social cognitive theory. Now, like I said before, you want to go back and do some thinking. What is the basis for all of these theories? Now, if you look at those theories, now note that the question didn't say what theory will assist you. The question says what theory will best assist you. So it means that whichever way you look at the 4 theories in these options, you can tweak them to fit into this program. However, look at the question again. What theory will best assist you? Now let's pick these theories apart one after the other. What is the theory of the planned behavior? The theory of the planned behavior is what you look at for between attitude and intention. Your intention to carry out a behavior and the attitude of the priority population or the participant. That's the theory of the planned behavior, all right? However, the question says we are going to conduct a legislative advocacy, all right? A legislative advocacy. Now, let's look at option C, trans-theoretical model. We just talked about it, right? So this is a change model, And most times it's not for advocacy. It's, these theories have different categories. We have the community level, we have the interpersonal level, and we have the intrapersonal level. The trans-theoretical is not a community-based approach. It is a personal approach. So a personal approach is not going to work at all for this question because the question is saying a legislative advocacy in the community. So we are taking that out. Now we're left with option B and C. Okay, option B and C looks so similar. And honestly, if this were not to be an exam, any of these 2 theories will fly in a program. Absolutely will fly, okay? Will fly. But let's look at option B. Option B says community organizing model. The community organizing model, and option D says social cognitive theory, all right? So the community organizing model, talks about applying a certain theory of change or for advocacy within a large priority population, all right? Organizing them into, advocacy sections. I already gave away the answer, and all of those things. So it best fits, all right? Understand that the question says which one best fit, all right? So the social cognitive theory can also be a form of interpersonal theory, which is not necessarily a community-based theory. So for me, the most important part in this question is you want to consider what are the levels at which these theories operate. Is it at the community level, the personal level, the interpersonal level, that is going to help you define the answers. Because honestly, in the exam, they can throw different theories around, which is not just limited to these four. So you must be able to identify which one is personal, interpersonal, and community-based level theory, all right? So I'm going with the right answer here to be B. To be B, which is the community. I'm going to type that again, community organizing theory, all right? So the next question. The health education specialist is creating a new program to increase cancer screening. Great. The specialist is also looking for evidence-based strategies to promote these mammograms. Which is the best source of information for that data? Now, there are about two components to this question. The health education specialist, S, is creating a new program to increase cancer screening, all right? A totally new program. The specialist at the same time is looking for evidence-based strategies, which means even though it is a new program, the specialist is also looking for something that has been done in this direction. So even though it's creating a new program, this specialist is not reinventing the wheel, as we love to call it when we're implementing programs, all right? So in terms of strategies, in terms of theories to apply, in terms of models to go with, all right, this person is looking for something that has been done. Now, the simple interpretation of this question is, where can this specialist find something that goes in line with this? Simple. Now, the first option says community assessment report. The second one says a guide to community preventive services. The third one says elder people 2030. And the fourth one says community toolbox. Now, let me begin by splitting these options apart from the last one, okay? So community toolbox, what is a community toolbox? A community toolbox is one of those toolboxes you're probably gonna see in your textbook. Case studies, all right? A case study in a book or in an article somewhere is not evidence-based enough. It is not, right? So technically that cannot be your answer. Now, when we talk about LD People 2030, we all know this just talks about the objectives for a certain disease or for a certain program that CDC has put in place together. So this question is not talking about we are looking for objectives. If this question had said the specialist was looking for objective-based strategies, something like that, of course, your mind should be going towards LD People 2030, because the basic thing we go to that website to do is to get the objectives and implement a new program according to those objectives. Now, the two tricky ones, A and B. So what do we do here? Now, what is an assessment report? An assessment report is a good source for data, but it's not just the best source for data, because in that assessment report, you have things that are not only for data, right? You have evaluation models, you have implementation protocols, you have a needs assessment gathering. You see, it is a report. It is not a data getting website or a data getting resource. Of course, option B says a guide to community preventive services. Of course, under a guide to community preventive services, which is what we are trying to do. If you are trying to implement a cancer screening program, technically we are trying to render a preventive service. All right, so you know, we talk about primary prevention, secondary prevention, and of course tertiary prevention. I'll leave that to you to decide what form of prevention this is. However, cancer screening is a preventive service. And of course, the best way to find the data, evidence-based strategies that have supported what has been done in the past is to go into the guide for the Community Preventive Services book. So also, I'll be going with option B for this question. That is a guide. Let me see. Guide to Community Preventive Service. Okay, next question. A health education specialist needs to find adaptive leadership training to learn how to more effectively communicate with diverse populations in the community in which the specialist serves. Which of the following training titles and modalities would be most appropriate to meet this complex professional development goal? Interesting question. Option A says risk communication for public health emergencies. Option B says intergenerational dynamics, speaking the lingo of different languages, of different age groups, for sex education, 2 hours in-person workshop. Option C, listening with cultural humility before communicating your message. Hybrid, 2 hours in-person workshop plus 2 coaching calls. Option D, how to write more clearly, a primer for health literacy, a 3-hour online self-paced model. All right, I'm just going to go straight to the answer for this one. Option C, I believe that's your best answer. All right, so now this is the tricky part about this question. Okay. We are trying to find an adaptive learning training pattern. At the same time, we are trying to understand what the title is going to be. So you are technically considering 2 things. What is an effective leadership training method? And at the same time, what name can you give to this training method? First of all, second of all, the question says a diverse population. Remember what we always say about talking to a diverse population? Cultural competence. And of course, under cultural competence, you have cultural humility. I think this is probably, again, one of the easiest questions. And to be frankly honest, one of the easiest areas of responsibilities in this exam. Okay, so the right answer, option C. Let me see. It's too long to type. I'm just going to copy and paste again. All right, listening with cultural humility before communicating your messages. Hybrid, 2 hours in person, workshop plus 2 coaching calls. Okay, great. All right, let's see. Next question. Health education specialists are encouraged to employ health literacy universal precautions when interacting with patients and delivering health education materials to communities, right? According to the Agency for Healthcare Research and Quality, please, these abbreviations are important. I have a list of abbreviated words for this exam. If you need it, reach out to me. Which of the following is not considered a health literacy universal precaution? Option A, use short sentences consisting of no more than 25 words. Option B, supplement text with relevant multimedia, including images and videos. Option C, use numeric rates and statistics to enhance the credibility of your message. Option D, highlight, bold, or create text boxes to display important main points. Now listen to this. All of these options are right. Here, there is no bad option, but The question says, you see, one of the interesting things about this exam is it's just a game of words. As far as you're concerned, all of the options could be right in most of these questions. But the question specifically says, which of the following is not considered a health literacy universal precaution? Universal is the key word. So it means it is not widely accepted. Not widely accepted, okay? Not widely accepted. That is the key word. Now, you can use short sentences consisting of no more than 25 words. That is great, especially when you are in andragogy class, a class for adult classes. All right, this is going to be perfect. You're using short sentences, maybe no more than 25 words. Okay. Obviously, we've always encouraged people in their PowerPoint presentations, in their evaluation presentations, use supplemental text with relevant multimedia, including images and videos. They convey the message. Of course, if you're talking to a couple of professionals like you and I, you can definitely use numeric rates and statistics to enhance the credibility of your message. I mean, in the health world, especially public health, we live by data. You can also highlight bold or create text box messages to display important points. Amazing. But the question says universally accepted, a universal precaution. The answer is going to be C. And why is that? Give me a minute, I'll explain that. The answer is going to be C because it says universal. It is not in all places that you're trying to convey a public health message, an evaluation message, probably an implementation message, a needs assessment message to stakeholders and all that you're going to be able to use statistics. Now, just imagine you're teaching an adult class and you go in there with SPSS. My goodness. Just imagine you're teaching high school students and you go in there with SPSS and a lot of these diagrams and you are just trying to communicate these public health jargons to them. It is right, but not appropriate for that situation. So the question here says, a literacy universal precaution, something that is acceptable everywhere. And of course, the odd one here is going to be using numeric rates and statistics to enhance the credibility of your message all the time in all situations. It's not going to work. Okay, it's not going to work. Okay, next question. To increase self-efficacy to resist peer pressure. To increase self-efficacy to resist peer pressure to use substances, the health education specialist curriculum should include one of the following. Number one, small prizes for completing all homework assignments, like incentives, okay? Option B, activities that reinforce the negative consequence of substance use, okay? That is a negative framed message. It works sometimes. I'm not saying that's the answer. Option 3, trained peer leaders elected to implement the classes. Sometimes, especially in high school, middle school, peer leaders, peer group mentoring works, okay? Option D, role plays and group activities that demonstrate refusal skills. What you're trying to get them to do is to increase their efficacy to resist peer pressure, to probably use tobacco, to probably use drugs, to smoking, right? All of these are right. Again, which one should be the priority here? And of course, it's going to be option D, role plays and group activities that is going to demonstrate the refusal skills. So there is one thing option A to C has in common. And that is explanation, telling them how to do it. However, option B is slightly different. You're not just telling them, but you're showing them through this method of advocacy, role playing, and group activities. They need to see what they're going to be doing out there, right? So it's not just about their communication skills this time around. And of course, role play and group activity are also part of communication skills. In fact, as a teacher, in my previous years as a teacher, role plays has been my go-to activity because it speaks better to the students than just explaining things to them, okay? Than just explaining things to them. So here, my right answer is going to be D, and that is going to be, let me see, role plays, okay, and group activities that would demonstrate refusal skill. All right, next question. A smoking ban in casinos is which type of strategy in a statewide smoking prevention program? Emphasis on statewide smoking prevention program. The first one says health communication. The second says option B, health policy. That's good. The third one says health mobilization. That is also good. The last one says behavior change. That is also good. Again, I've said this before. Always look out for the best fit for the question. As far as we are concerned, the public health, if you are implementing a smoking prevention program, it is for behavioral change. That is also part of health communication, right? That is part of health mobilization, and that is also part of health policy. However, the question laid emphasis on a statewide smoking prevention program. If it's going to be done in a statewide means, that means it is no longer an individual thing just for behavior change. We are not just mobilizing people to do it, because by the time you mobilize people to do it, they can opt out. They can decide not to, all right, in a public space. However, when you make it a policy, it becomes a law. And the key word here is also you are banning it. You cannot ban anything without it being made first into a policy. You can't, all right? You can't. You can use all the models of change that you want and that you have on public health, but if it is not passed as a policy, it might not just be as effective. So for example, in Fresno, last summer, we were working on a policy that says smoking shops or smoke shops should not be at a certain feet to high schools, all right? If we had left it like, oh, please, don't put a smoking shop here. Let's not do it that way. It's not going to work. First of all, we needed it to be a policy. It's a ban, and it's a statewide. A statewide means it is backed by the state laws. Okay, so I think this is also fairly easy to an extent. The right answer here should be health policy. Health policy. Okay. All right. Next question. Forgetting to inform participants about the risk associated with physical activity before having the participant begin a program is an example of what? Commission? No. Deregulation? No. Ethical compliance? No. Negligence? Yes. All right. I think that's pretty straightforward. The answer there is negligence. Okay. Next question. According to which theory or model do people assess the threat of an imagined disease, by assessing their perceived susceptibility against the severity of the disease? Okay, sounds like a whole lot of words, right? I know. The first one, option A, social cognitive theory. Option B, diffusion of innovations. Option C, health belief model. Option D, social marketing. Now, begin by answering the question through the elimination method. Okay? First of all, let's eliminate social marketing. That is not a model for assessing the severity of a disease. No. Okay? Social marketing, social media, communication, advocacy, that could be a viable option. But in this case, it is not a viable option. A, social cognitive theory. Maybe that could work, however, it's not. Because here, we are trying to assess the threat of an emerging disease. Social cognitive theory in itself, it's all about health promotion, behavioral compliance, all right? It's not so much about assessing diseases, okay? Diffusion of innovations. And for those probably you know what this is or you don't, I'm just going to explain in a minute. Diffusion of innovations, we talked about people's acceptability of a new information. And under this, we have different categories. We have the majority group, we have the laggards, we have the early majority, we have the late majority, we have the innovators, we have the actions, okay? So this doesn't apply here, all right? Because here we are not just trying to introduce a new form of information, a new form of technology, a new form of health pattern. No, that is not what we are doing, okay? We are assessing the threat of a disease, okay? And that leaves us with health belief model. Health belief model is the best fit for this question. Why? Because in the health belief model, people tend to assess what is out there. And let me say it explain in public terms, all right? So for example, during the COVID season, when COVID broke out, the pandemic came out, I think a lot of people unknowingly engage in the health belief model. Why? Because they assess the nature of the disease by themselves, they assess the severity, they assess the susceptibility. And in terms of words, if I use a mask, am I going to die? If I don't use a mask, am I not going to die? They were testing their own belief system. For example, the Ebola situation in Africa. I had a couple of people come in and said, oh, they said, if I have my bath with salt in the morning, okay, this disease is not going to affect me. They tested their own health belief model. It is a personal kind of health model, all right, that allows you as a person to look at this disease and measure the severity, measure the threat, and measure the solution yourself at the same time, all right? That is what the health belief model does, okay? So the right answer here is going to be the health belief model. The health belief model, okay? All right, we're almost there. The next question. To understand the three main subject protection guidelines, respect of persons, beneficence, and justice, one will look to the what? Now, this was a tricky question for me. And I had to get clarity on this question during this period of studying for the exam, okay? And this is it. Option A says CNHEO Code of Ethics, could be right. Option B says Institutional Review Board, could be right. Option C says Belmont Report. Option D says Geneva Convention Treaty. Now, if you look at this question carefully, the question says, if you are looking to find the guidelines, in which book will you find the guidelines? That is the simple question. However, one could argue between B and C if you want to, but don't, because B is a review board. B is consider B an ethics evaluation system that goes over what you have established that you are going to do and see if you have followed these guidelines. So in essence, you cannot see these guidelines or these 3 criteria in the review board because they are meant to establish if you have done these 3 things. So the best place you're going to see this is in the Belmont report. Please remember, it's so common in all of the questions I've seen. The Belmont report is where you are going to find the 3 young men that are the guidelines for human subject protection, respect for persons, beneficence, doing no harm to nobody, and justice, equality for all people. Okay, equality for all people. All right, so the correct answer here is C. I'm going to go with Belmont report. Okay, Belmont report. All right, next question. The organization that accredits schools of public health, graduate programs in public and community health, and all the graduate programs is what? A says SOFI, B says NCHEC, C says SEF, and D says CAIP. So SOFI, like I said before, we are going to have a bunch of those questions in the exam that talks about abbreviations and their meanings, what they stand for. You need to understand that, okay, what they stand for. So SOFI stands for the Society of Public Health Education. So it's a society, it's an association, right? All right, but they don't accredit. NCHEC is the credentialing body, right? So the NCHEC is the exam you're taking now. That is the body responsible for the CHES exam and the certification you get afterwards. The SEF is the Council on Education and Public Health, and that is the body that accredits the School of Public Health. Remember the first word, a council. A council accredits, okay? A council accredits, all right? So C seems to be the right answer here. And like I said before, if you want the list, no, sorry, I think I have no say. If you want the list of abbreviations, you can reach out to me. I will forward it right across to you. All right, next question. Pretty simple. Also, it's all about abbreviations. The abbreviation questions are beginning to trickle in. And I spoke to people who wrote this exam last year. They said there were lots of abbreviations in their questions. So please take note. Health education specialists are ethically obligated to ensure confidentiality and to protect the privacy of all clients. The law that protects the privacy of patient information is what? Simple. Now, this is even more confusing because everybody in the public health system seems to know the acronym, but may not necessarily know the full meaning of the acronym, right? So option B and D look similar. The full word is EPA, right? Look at that, interesting. Look at that, EPA, right? But there's not so much difference there. However, it's Health Insurance Portability and Accountability Act. I really hope I'm right. I hope I'm right. It's also confusing to me right now. I'm looking like, what are we talking about, right? Well, I'm gonna go with D in this case. It's not Profitability Act, it's Portability, Portable, okay? Act. All right. Oh, last 2 questions. Awesome. Let's see. The following are the benefits of involvement with coalitions, collaborative partnerships, communities of practice, and other networks, except what? A, creating common ground and identity among disciplinary and multi-sector partners, persuading collaborators to view social issues from the organizer's perspective. C, enhancing learning by bringing together stakeholders with varied experiences. D, building capacity among organizations to address community issues. So the question is basically saying, which of these options, right, is not a benefit, is not a benefit of building relationships and partnerships in public health? Which one is not a benefit? All right. So I think the one that is not a benefit is pretty easy here, easy to figure out, right? Easy to figure out, and that should be B. We wanted to view social issues from the organizer's perspective. That's not why we're here. We are here for communication, we are here for collaboration, and we are here for partnership. Okay. So last question. A health education specialist is developing a new website for people with visual disabilities. We lost option A. Okay. Which law should the health education specialist review and consider when developing the website? Which law should you consider? Which law should you review? And of course, pretty straightforward here, Section 508 of the Rehabilitation Act. Section 508 of the Rehabilitation Act. When we talk about the Plain Language Act, this is other communication, which is simply an act that has been passed that anyone, absolutely anyone, must be able to listen, read, and write clearly without any form of extra explanation or extra inclination to what you're saying. They just must be able to understand. Paperwork Reduction Act, literally what it says, what it means. And of course, Section 508 talks about our disabled people in the system, all right? Our disabled people in the system. So this brings me to the end of the CHES Area 8, Ethics and Professionalism questions. If there is, if you have any questions, you have objections to some of the answers and the explanations I've provided, please do reach out to me. I look forward to hearing from you. I am also taking the exam, so I also need all the support I can get in this season. All right. So if you have a particular area of responsibility you would like me to talk about, you would like me to bring out the questions and just do the explanation on it, please do not hesitate to let me know. Thank you so much. Look forward to hearing from you.